Hi, I'm Shane Bales, Doc Hockey for Pro Action Sports Injury Clinic. We're doing ulnar nerve flossing today. So the ulnar nerve comes from the neck, goes underneath the clavicle into the back part where your subscapularis muscle is, one of your rotator cuff muscles, goes underneath there, goes into your intermuscular septum, along the elbow, underneath where that funny bone is, kind of goes in that little tunnel there where your flexor carpi ulnaris sits, and it goes underneath that. Comes downwards, you have your pronator quadratus across the wrist here where it kind of dives underneath that, goes through the tunnel of Guillain, that little bony hammer-like extension of the bone that covers the tunnel, goes into the thenar muscles, and then it goes into the pinky finger and usually half of the ring finger that it innervates. So you might have that type of tension of numbness or tingling in those areas. A lot of times it's the hand that feels it the most because it's the weakest link where the nerve is stretched the most through there. The burning pain, numbness and tingling, and sometimes you're going to have just even pain in the neck because it can be a disc issue that's causing this type of nerve entrapment. So the ulnar nerve would be shortened with your head leaning towards that side, so it's slackening that nerve. Arm is down with the hand kind of turned inwards and downwards and flexed. So when we want to stretch it out, we bring those fingers backwards, okay? We would be bending the elbow, bringing it up, elevating the shoulder, or abducting the shoulder, and then we're putting our palm basically on our neck, extend as much as possible, and the head goes to the opposite shoulder, so the ear to the opposite shoulder. And we do that, and you should feel this tension. You should feel that through the fingers that you're doing that because you're turning them downwards, the fingers that we talked about, the forearm anteriorly here, down through the middle part of the tricep and the bicep, so right in the middle part there, and you can feel it into the shoulder as well, okay? So that's how we do shorten. So the flossing would kind of look like this, where we're kind of having it down, we bring the elbows back, elbow bent, bring it up, over the head, over to the side, and we'll do those several times to kind of get that flossing going. So the nerve is pulled through each of those little holes that we talked about where it was diving under, hopefully to break apart any of the glue that's sticking it together, the entrapment sites through there. So there are modifications you can do with this as well. When you have it here, you can bring the head back and forth, or you can keep the head in neutral if it's too much pressure. All right, you can always want to start maybe least invasive, which would be just the fingers. So if I have my hand over here, I can just use my fingers and my wrist to kind of go back and floss that part. I'm pretty good with that. Then I might want to try bending the elbow, flexing it back and forth. Okay, I'm pretty good with that. I'm going to rotate it, right? So I'm going to go like here, bending the fingers back and forth, bring the shoulder up in extension. How am I doing with that? Keep my head in neutral. Then I might bring it all the way through here. And then I can still flex my hand. How am I doing that? And then do with the head, and we talked about the flexing with the head. But I like to do the whole thing back and forth so that you're pulling that nerve all the way through the canals and then slackening it, pulling it back and through, kind of like a tug of war to help get a little bit of that tension through the nerves, because it's going to be aggravated. It's already an inflamed nerve. We're flossing it back and forth. Those little spots that it's pulling tight, it's going to stretch it out a little bit. But what we're trying to do is break that down so there's a lot less slack when we're doing everyday activities, which can be very beneficial in the long run. If it is too aggravated, so my rule is usually about 10 to 15 minutes, it kind of goes back to pain baseline. If it's not doing that, then you might want to say, okay, well, let's do it a little bit less. If you can tolerate it a little bit more, it might be better. I would ice down the neck for sure when we're doing this, just because it'll decrease any inflammation if it's coming from the neck. And this is usually the most provocative place doing this back and forth. That's why sometimes people don't incorporate the neck lateral flexion or side flexion of the neck to produce this type of exercise. They kind of stick with just the arm stuff, okay? So think about that, and remember, consult your healthcare practitioner. They have a lot of great ideas of where your actually condition is at, so they can tell you the modification they might want you to do so that you're doing it appropriately and you're not inflaming it too much that you're kind of reducing the amount of recovery and possibly stretching that nerve a little bit too much, which is sometimes not a good idea because it can cut off the circulation. Anyways, remember, improve yourself with home health. Take care. Good to talk to you. Hope that helps you with your median nerve entrapment sites and the flossing to help improve that. Take care.